Well, as you probably heard from Mohanad, Cortex and has a bold vision into the future of health transformation. But before we get started, we practically look at health transformation as a journey, and effectively, as a new bold player into this field, it's exciting to be equipped with the right experience, the right credibility, and at the same time, we intend to make a difference, a real difference into this space. So now I'm lucky to be joined by our exceptional group of experts and leaders in the health space. And I'll start introducing one by one. Dr. Regina. Dr. Regina is a principal consultant of public health, and she's a physician by background, holds a master's of public health from Harvard University, and she worked extensively with the World Health Organization in research and health policy. Dr. Zainab, her first bachelor degree is in medical field. Her second bachelor degree is in electric and electronic engineering, and she holds a diploma in the AI field as well. Dr. Malik is a managing consultant in the digital health. He's a certified clinical researcher, healthcare quality expert, and a certified business analyst. And last but not least, Dr. Laurette. She's an epidemiologist, biostatistician with an extensive experience in the UK and UAE with more than 20 peer-reviewed publications globally. So thank you all for being here today. It's an honor to have such a powerhouse panel, and let's just dive in for the sake of time. So I'll start with Dr. Regina, and maybe this is a question that everybody in the audience might be thinking about. What drove the name of Cortex and what is the idea behind it? And just if you can shed some light.
Thank you. Thank you so much, Zahir. Thank you so much, dear colleagues. So the human brain was a true inspiration for us. And as you know, cortex is the outer layer of the brain with all the folds and grooves. And that's what we usually imagine when we think about brain. And it's a fascinating part of our body, actually. It's only a couple of millimeters thick, but it has billions of nerve cells. And they actually make us who we are. So, for example, it's responsible for our behavior, our intelligence, our creativity, and even our personal traits. There are other regions that collect and interpret all the sensory information from our body, from our ears, from our eyes and skin. That's how we make sense of the world around us. And there are some other regions that actually help us to understand the languages and non-verbal communication, such as facial expression and body language, and that's how we can understand each other. So cortex really takes care of it all, of who we are, how we interpret the world around us, and how we interact with each other. So this became the inspiration for the name, because that's how we see ourselves, and that's what the values and the approaches that we want to follow. So for example, as human brain cortex navigates the complexity, enables us to navigate the complexity with curiosity and precision, that's how we approach the issues of the clients that we are having. And that's how we approach the healthcare as a dynamic system that is interconnected. And we basically try to embrace the complexity rather than simplifying them. At the same time, we want our solutions not only be evidence-based, but context-specific. So we really, as Cortex, use all of our senses to use all the information we have and to come up with the targeted and tailored solutions for our client. And there is also this "and" part to our name, which is about future. And that means that we as an organization don't see ourselves as static. We are constantly evolving, we are pushing the boundaries of what is possible, and we want to redefine what excellence looks like in the field. So this is basically Cortex N. This is ours, that's who we are, that's our intelligence, creativity, and adaptability. But it is also how we navigate the context around us and how we build strong and trustful relationships with our clients.
Thank you, Dr. Regina. Moving to Dr. Zainab, can you share more about the company's mission and how does it stand against a competitive field in general? What sets Cortex and apart?
I think everyone coming here already are aware that healthcare is really improving fast. And we never witnessed in any time before. There is an actual era where healthcare can improve constantly, and we can see now how things that we challenged us throughout the years now can be solvable. Because we have the technology, because we have the understanding of the healthcare system in a way where we no longer separate it from each other and solve each part alone, apart from each other. So I think our mission is to really bring that understanding to the healthcare in a way where we are vigorously solving the problem in an ecosystem of components happening around it. And we don't ignore any of the components. So one of the examples that I would love to give is that if you look at a hospital in the healthcare setup, it's usually what we think about in healthcare. But this is just in one node in a very complex system that actually allow that hospital to function in a specific way. So our mission is to bring that kind of intelligence into understanding all of the different nodes within that healthcare and all of the beneficiaries' needs, from human needs and as well as all of the components from operational aspects as well. Do we going to reach a time in the healthcare where we are not seeing those problems again? This is what we are aiming for, to make sure that one day we are forgetting about the problems of healthcare in any time very soon, inshallah.
Amazing. Thank you, Dr. Zainab. Moving to Dr. Malykh. So Cortex provides a wide range of services, or at least this is the promise. So can you shed some light on those core services and how they are designed to meet the future needs of the healthcare industry?
Thank you, Zahir, for your question. So at Cortex, and we believe true transformation is not just a goal to be achieved, it's a journey. One is asking for a strategy, another is asking for a sustainable model, a third is looking for the power of AI and the data itself. At Cortex, and we are driven to achieve a commitment to empower the health ecosystem and to leave long-lasting impact with initiatives that has a maximum benefit to the ecosystem. At Cortex, and we have a focus on 4 pillars. Together, they complete the digital value chain, yet each pillar stands strong by itself. So Cortex and strategy is number 1, Cortex and business model, Cortex and data enrichment and utilization, Cortex and AI strategy and agenda. If I can elaborate more to explain these offerings, before we start, we always do a simple act, but very powerful. We are listening. We listen to the client to listen to their challenges and ambition. From there, we dive deep to understand what suits this client and what can we deliver to them based on the 4 offerings. So Cortex and strategy, it crafts a tailored strategies and strategic blueprint and roadmap of initiatives that will turn vision into reality and make a transformation, precision transformation, tailored to their needs. If we move to the business case, Cortex and business case, any successful initiatives should be safeguarded by a business case, and that's where Cortex and offers to develop a well-structured, technical, operational, financial, and business models. Giving such models to the decision maker, it will create clarity and confidence, guide them step by step how to develop and operate, and most importantly, ensure investment will deliver the return expected. If we move to the third pillar of Cortex, and which is the data enrichment and utilization is one of the offering of Cortex, and the data is the most important asset of the healthcare system. And this data has to be maintained and enriched internally to make sure it has that quality, and enriched whereby integrating with external data sources aligned with the objective of the organization. But what is enrichment and utilization? So any enrichment has to be tailored to strategy to deliver a proper utilization and benefits to the organization. Last but not least, which is the AI strategy and AI agenda, and if I can explain it quickly, AI agenda, strategy is building a strategy of that tailored to the organization, which AI models, which AI use case will benefit the organization. But the AI agenda is basically how to develop it, which data sources, and this will be customized and tailored to the organization. These are the 4 pillars, but we are looking to expand the pillars with more services to be provided. But these are the focus for now.
That's great. You mentioned a very important topic, which is data. And I know this is a dear topic to you, Dr. Laurette. So the question, how Cortex and leverage this data for better utilization for the healthcare providers, and how is that going to impact the overall patient care system overall?
Thank you very much, Zahir, for the question, and to my team here. I'm delighted to be here celebrating this momentous occasion, the launch of Cortex. So to address your question, data drives all decisions that we make in healthcare. And when we think about this across all levels we see within the sector, it becomes very obvious. So when we think about patient level, we are now seeing increasing availability and integration of different data sets, which are opening new pathways to disease prevention and cure. And then we can think about it from an organizational perspective. As they seek to improve processes, they're facing new and evolving challenges daily. How can they improve efficiencies? How they can really optimize on their outcomes to achieve sustainability. So in essence, data tells us about our past, our current state, our present, and the possible futures. And it is with this innate understanding of data and its power and the essence of it that we at Cortex and unlock its potential to deliver transformations that are really impactful. You know, they enable organizations to realize their ambitions and goals. When we think about how, and you're probably wondering, how do you do all of these amazing things? We adopt a really holistic approach to how we look at data. We leverage scientific methodologies, obviously my personal interest. We use evidence-based methods to really gain a complete, full picture of the state of an organization, what we can see, and also importantly, interrogating what we can't see. What additional pieces of information would add value to our view of the problem and therefore the solution. Through our data offering, we equip organizations to make data-driven decisions. And this is the buzzword. This is what everybody wants. Making data-driven decisions with the necessary insights and the processes for them to be able to leverage their data themselves in a sustainable way, in ways that really work for them. This can be through increasing interoperability, integrating different data sets, improving the quality of their data. And all of this is really at a foundational level, rooted in a deep understanding of how the data elements are related to each other. We offer these unique insights. You know, I'm going to plug the team now. We have a wealth of experience, very diverse, very rich team, rich experiences, and we adopt an out-of-the-box thinking approach when we look at data and really push the boundaries of what is possible with the data we have available to us.
That's amazing. So let's talk about something that is equally important, which is sustainability, and I'll direct the question to Dr. Zainab. So changes are going to happen and it has to be impactful, but also how do we guarantee that they are sustainable, that they carry the organization into the future as well?
I think this is one of the major components of really designing solutions in a way where we are considering 3 things. One is basically when we look into the vision and we look at what's coming in the future, it's usually it's what we are trying to kind of adopt for the future, but at the same time, we're adopting for current problems. That duality in the approach makes us able to solve for today and solve for tomorrow.
Amazing.
So one of the major problems is usually that we are trying to solve problems of today, and sometimes that is actually too late to solve. What we try to do is that we want to see, okay, if we have this problem today, what are the consequences of it? Can we predict what's going to happen? Can we understand what actually the causes of what happened? And if we understand that very well, we would know how to sustain a system that sustains itself in a way where it can improve over time. This is the first one. The second is during the design itself, we consider things like change management and other aspects of understanding of how to make it operationally sustainable. And this is one of the major components of how to leverage all of the data that we gathered to understand what could be sustained at operational level. And the third piece is always forgettable, but really financial sustainability for any system
Absolutely.
is supposed to be always considered in the solution.
Yeah, that's amazing as well. Well, Dr. Regina, that also takes me to the next question, which was probably the last question for now. Like talking about sustainability and talking about this from the early design, in your view, like what do you see that the next frontier when it comes to the healthcare transformation? As this is key, like of how we put our minds into the design stage of Cortex and.
Thank you. We look into the future with clear focus. We definitely want to continue to expand and evolve our services and our expertise, but we don't want to do it just to keep up with the change. We want to be proactive, as Dr. Zainab mentioned. We want to really help to shape the future of healthcare. And we believe in thoughtful transformation. So as health systems become more complex and they experience increasing pressure, our services will continue to be context-specific, evidence-based, and designed to provide the biggest impact. At the same time, for us, it's about solutions that are strategic, as Dr. Malykh mentioned, sustainable, thanks to Dr. Zainab, but also context-specific and embedded into the organization's realities, not outside of it. And in addition to the four offerings that Dr. Malykh mentioned, we are also considering the research consulting as the natural next step for us, as we will be able to support our clients not only to apply the evidence, but generate their own localized evidence. We will also be able to help them to evaluate the impact and make more better informed, data-driven, and forward-looking decisions. And we want to remain very collaborative. And in our collaboration, we work very closely with our clients as we are trying to develop the strategies that are not only, business model operated, but they are built together with the implementation in mind. For our AI agenda, we wanted to add value. And for our data monetization and enrichment services, we want them to provide meaningful insights. So with all of this, we also are going to extend and improve our own expertise and continue to build partnerships that are driving us into new markets and into new opportunities. And to just, sum up the overall point is that what is the future of Cortex and look like for us? So for us, it's the one where we remain true to our values, which is partnership, purpose, and authenticity. We also will continue to walk along our clients to help them to solve the challenges of present, but also prepare them for the future. And we will remain the healthcare advisory that you will trust, because for us, true transformation is not only about innovation, it's about relevance, resilience, and meaningful impact over time. And this is the work that we are here to do. Thank you.
Thank you very much. And thank you to all of our panelists for sharing your insights about Cortex. And I'd love to hear from our audience as well. If you have any questions, feel free to ask. We're here to continue the conversation as well. If you have any questions here. Over there.
Hi.
Hi.
I would like to ask, how can you ensure that any innovation you bring as Cortex and will ensure that you're not disrupting existing any processes or negatively impacting them?
A very good question. Who would like to take this one? Dr. Regina, Dr. Zainab? You got the question, I would assume.
Yes. So the question was basically, how do we ensure that there is no disruption to the continuity of the operations?
Yeah.
And the main one point that we need to do is that if we don't have that layer of change management as part of the solution, it's usually we are guaranteeing failure almost always. But also we want to make sure that we are understanding the system very well in a way where we really comprehend what are the things that influence the system versus the ones that are really could be a trigger to failing of a solution that we are trying to implement. So we think about implementation in a way where we test different pilots either conceptually or actually in reality. And this is how we develop it over time until we know that this is not going to disrupt the system. The second piece is that we usually going to do it on phases, and that would allow us to really come back from any point of disruption that is irreversible to make sure that we're not really having those negative impacts. I hope that answered your questions.
Thank you, Dr. Zainab, and thank you for the question as well. I think if we don't have any more questions, we can wrap up the session. Whether you have a special guest. Okay, so I'll hand the mic to Mohammed.
Thank you all for attending. We have a very special guest to us, His Excellency Mr. Ibrahim Al-Jallaf, Executive Director of Digital Health at Department of Health Abu Dhabi.
Thanks, everyone. I'll stand on the side. Listen, thank you, everyone, for coming and joining. Now, we've been kind of Malafi behind this, which is now launching Cortex. And first of all, big congratulations to you and the team for launching this. We've been collaborating for quite a few years, alhamdulillah, very successfully. Malafi as a platform is scaled and one of the best globally, mashallah, and it's driven an incredible amount of impact so far in Abu Dhabi, and a lot of the learnings from there are clear and prevalent. I think this is an opportunity now for them to benefit the globe, and we're great to see kind of this educated learning and sharing across borders. But also we believe that it grows the knowledge and the ability to drive impact also back in Abu Dhabi. So this knowledge sharing lighthouse is brilliant. Big congratulations to you and the team.
Thank you very much. Thank you very much.